So I'm delighted to be joined by our panel of experts who will talk about why sustainability is so important for communication professionals and the ways in which you can communicate sustainably, avoiding pitfalls such as greenwashing and overstating eco-benefits. So firstly, I'd like to introduce you to Jo Taylor, who is Director of EU and UK Policy Government Affairs at Seqirus. So Jo is currently responsible for EU policy for both pandemic and seasonal flu vaccines. She's worked in the pharmaceutical industry for about 30 years, leading UK and EU corporate affairs departments. And during the pandemic last year, this is very exciting, Jo was seconded to the government's Business, Energy and Industrial Strategy Department on a secondment with the Vaccines Task Force. And she also chairs the Foresight Committee and is a board member of the Healthcare Communications Association. Next up, we have Hayley Carmichael, who is Communications Manager, Care Without Carbon from Sussex Community NHS Foundation Trust. And Hayley joined the Care Without Carbon team in April 2015 to lead on communications activities around the Dare to Care campaign, supporting the delivery of the Trust's award-winning sustainability programme. She has a strong background in corp comms, both in public and private sectors, and has also worked internationally. Her interest in psychological aspects of communications has also led Hayley to train as a psychotherapist, really interestingly, developing listening skills, which have come in very handy for talking to staff about sustainability. And last but by no means least, we have Anne Coleman, who is Senior NES Zero Engagement Lead at NHS Improvement and in England. Anne is a strategic comms professional with more than 10 years experience working in the fields of science, technology and health. And in her current role, Anne leads on comms and engagement for the Greener NHS, which is NHS England and Improvement's national programme. And she's previously worked for organisations such as Cancer Research UK and The Lancet, as well as doing a 3-year stint in Australia with a communications agency. So a worldwide perspective from Anne. So this session is the first of the CIPR Climate Comms series, which is great to be part of this, a series of 10, so you'll find 9 others. The session is being recorded, so you'll be able to listen in at a later point, and you can join in the conversation by using the hashtag CIPR Climate Comms on Twitter. So the way it will run, we'll hear from each of our speakers in their area of expertise, and then we'll move into a question and answer session. So please do have your questions ready for putting into the Q&A box, and we'll try our best to get round to them. We've got lots of other questions as well, but certainly we'll want to hear your questions too. So without further ado, I'll hand over to Jo Taylor, who will talk on how communicators can make a big difference to the climate crisis.
To be invited to talk at the CIPR event, and it's nice to meet you all, even though I can't see you. As Sarah said, I'm Director of Policy for Seqirus. We make seasonal and pandemic flu vaccines, but I'm not here in that capacity today. I'm here as a board member of the Healthcare Communications Association. We're the professional association for healthcare communicators, and as Sarah said, I'm chair of the Foresight Committee. And the Foresight Committee, the primary aim of that committee is to keep our healthcare communicator members informed and equipped to deal with future trends in healthcare comms. And perhaps unsurprisingly, sustainability is our #1 topic or trend that members are keen to stay on top of. HA has done a number of initiatives on the subject of sustainability over the last couple of years, and I'll touch on those a bit later. So firstly, how can communicators make a big difference in sustainability, and why is it important for healthcare communicators and business specifically? Well, first and foremost, it's not just important for healthcare communicators, it's obviously critical for the planet and our very survival. If, like me, you were tuned in to COP26, you'll have seen that underlined the science is calling for a step change in approach. Global warming is well underway. We have a 1.2 degree increase in global average temperatures above pre-industrial levels. If we do nothing, warming is projected to be 2.7 degrees by 2100 if we stick to pre-COP26 policies. And that will mean a significant risk to human life. 800 million people will be at risk from rising sea levels. 1.7 billion people will be experiencing severe heat waves, and there'll be a 25% loss in GDP. Sorry to start on a downer. But COP26 target is for a 50% reduction in emissions by 2030 to limit warming by 1.5 degrees by 2100, which is in line with the Paris Agreement. I just wanted to start with that because I think it's an important reminder whenever we're talking about sustainability of actually what we're talking about. I thought the headlines that I saw certainly were quite negative in relation to COP26, and I did a bit of digging and research for this talk and was surprised at actually how much progress has been made in key areas. And I just wanted to pull out a couple of those to cheer ourselves up, but 90% of the world is now committed to net zero after pledges from India and others. The Paris rulebook is completed, so we've got a creation of international carbon market and stricter emissions disclosures, phasing down of coal and fossil fuels, which took a lot of the headlines as well. Joint policy commitments on deforestation, methane and international coal financing, reinvigorated international collaboration, and headline was on US-China declaration on climate. The private sector mobilisation, which is the sector that I represent, 5,200 plus businesses and approximately 450 financial institutions are committed to net zero. That represents 40% of financial assets. So a lot has been achieved at COP26, but I thought it would be helpful to look ahead at what business impact we're likely to see. And I just wanted to pick out 4 things. And John, if you wouldn't mind moving on to the next slide, please. So you can see there the 4 things there. Business is likely to be directly impacted by consistent climate transparency requirements. And what that means is we can expect to see more stringent monitoring. In the UK, all businesses are required to report net zero transition plans. We'll also see a lot more from policy commitments, climate policy commitments, and there's likely to be far more incentives for curbing emissions and speeding up innovation and deployment. And you can see there an example is the EU's Fit for 55, which is the EU's proposed actions to how they're going to reach the 2030 goal, including a carbon border tax proposal. The third one is the voice of civil society. Expect higher demand for sustainable products, climate transparency and circularity from the public. 23% of consumers say they are buying more sustainable products since they were in 2019. And finally, an increasing focus on adaptation. There's likely to be closer scrutiny by stakeholders on resilience of business operations. And we saw the launch of the UN's Global Resilience Index, which is a framework for tracking transparency on country, corporate and supply chain resilience. So those things are just going to ramp up and increase. And the reason I wanted to pull them out is because those 4 main areas of direct business impact, I believe, are the job of the communicator and areas in which we can make a huge difference. Communicators play an essential role in sustainability by talking about evidence, and that's something that we do in healthcare communications and scientific communications as well, and we're well practiced in it. But we also need to keep people at the heart of climate action. We need to educate, empower, involve, and maintain a sense of hope, despite the scary headlines that I talked about. Creating change requires personal stories, activism movements, and business leaders making difficult decisions. Sustainability has started, I think, to be dehumanized, making it seem sort of unattainable, and communication is hidden behind complicated scientific jargon. Affecting global temperatures isn't something you feel you can actually do as an individual. So it's important to humanize it and make it feel achievable. And I think this is something that we are expert in. Just talk quickly about sustainable practices and how we can avoid greenwashing. I think there's an important point to make here, and that is the environment is just one component of sustainability, and it's a much broader concept. Sustainable access to medicines, for example, in developing countries is a big issue, and pharma companies will be at the forefront of criticism on that if they're seen to be only addressing the environmental targets and ignoring other elements. Companies will have to clearly articulate company values to increasingly questioning investors and customers, And they will also have to deal with regulators who will be demanding new parameters on which to measure companies and products. The company I work for, Seqirus, for example, manufactures vaccines, and these are mainly bought by governments for public health. And public procurement contracts now have big chapters on that are dedicated to sustainability, including social value, economic and environmental impact. Government will not award contracts to unsustainable businesses, they just won't. And as well as the commercial reality of the new world, the reputation risk around sustainability is very significant to business. If you look at the recent publicity around water companies dumping sewage into rivers and the public, and therefore government reaction to it. I'll just give you a sort of ending on a good example from the business world. And that is, we ran an event last week as the HCA called Good Cop, Bad Cop. It's a webinar around sustainability and COP26. And we had a really good list of panelists, but we had from AstraZeneca, Jason Snape, who's the Global Head of Environmental Protection at AZ. And he talked about the fact that AZ are developing a product sustainability index. So they're trying to build in sustainability in products from the outset to guarantee that any pharmaceutical products that come to market in the next 5 to 10 years will ensure sustainability across the entire product life cycle, looking at all aspects from supply chain through to manufacturing, through to pricing, and even drug wastage. It's difficult to do, but it's essential if companies are going to meet expectations from stakeholders. A really important element that needs to be looked at, though, is the whole investor value area. It's currently set up in a perverse way, I would say, that seemingly runs counter to what's trying to be achieved in sustainability. When AZ announced last year with Oxford that they'd offer up their COVID-19 vaccine as a not-for-profit to help vaccinate the world, the AstraZeneca share price went down. This is an undeniable disincentive to sustainable business practice. It's very difficult for any executive board to sanction activities that will result in a devaluation of the company. So a different way of measuring value to shareholders needs to be devised, I think, to effect meaningful change. I think in conclusion, I believe as communicators that we are best placed in any organisation to make the biggest difference to the climate crisis. Influencing opinions and behaviour of business stakeholders is where we will succeed or fail in the climate crisis, and we should harness everything that we know and act now.
Thanks, Jo. It's a really interesting point that you make about the scientific the jargon that sits behind a lot of how sustainability is communicated, and that we're placed to be able to help with that. I think that nicely segues into Hayley, who is going to talk to us about a whirlwind overview of the approach that has been taken at Sussex Community to deliver more sustainable healthcare and bring staff with the organisation on that journey. And I expect human language and breaking down scientific language is certainly something that you'll have touched on, Hayley. So over to you.
Thank you. May I have my first slide, please? Thank you. So I'm Hayley Carmichael. I'm Communications Manager for Care Without Carbon. We're the sustainability team at Sussex Community NHS Trust, but we actually work with pretty much every trust within our region on Care Without Carbon as well. So we've got a much broader reach through Care Without Carbon than just within our trust. If we go to the next slide, please. Thank you. So just a quick overview of what we do with Care Without Carbon. So it was launched in 2015, initial target 34% reduction by 2020. This was your more traditional stuff around, you know, improving energy efficiency, tackling some business mileage, that kind of thing. So by 2019, we actually surpassed our 34%, and by 2020 we'd got 42% reduction. So we've just developed a new strategy which will take us to 2025 and then 2040 with that net zero carbon ambition for 2040. The thing with Care Without Carbon that sort of made it stand out was it took a really holistic approach. So we didn't just, traditionally, sustainability tends to sit within the kind of estates and facilities functions of organisations. And we took a far more holistic approach that looked at sustainability across the entire organisation, both clinical, non-clinical. And we looked at the ways the entire organisation could contribute to us reducing our carbon emissions, which, given the net zero by 2040 commitment, has put us in really good stead for doing that, because you can't get to net zero carbon just by focusing on your buildings, for example. So Care Without Carbon was the kind of functional strategy to take us to carbon emission reductions. But we had an engagement program that was a sister program called Dare to Care, and that was really to get staff thinking in the first instance about how they could be more sustainable themselves as well as within the work context. So if we move to the next slide, please. So the idea with Dare to Care was, it wasn't about what you couldn't do, it was about what you could do. We were really determined to take a more positive and proactive approach. So it wasn't about sort of damning people for the things they were doing wrong. It was saying, you know, if you do these things, there's all these amazing benefits. And we tried to articulate that in 3 areas. So it was around how they could save carbon and reduce impact on the environment. It was about where they might actually be able to save some money, either for the organisation or for themselves, and also where it might improve well-being or their health in some way. And we've tried really hard to be consistent with that messaging throughout. So the way we asked people to do things was through a pledge-based system. We have around 10 pledges active at any one time. We would rotate what those pledges might be. We asked staff to nominate pledges. And then we also got staff to feature in how we promoted those pledges. So you can see on those posters there, we had real people who were committed to that particular pledge. We got them to do blog posts for us talking about why that mattered. So we had some really nice peer-to-peer influencing going on. So since we launched DARE, which was late 2015, early 2016, we've had about 3,000 members of staff taking part, and you can take more than one pledge. So over 11,000 pledges have been made to date. And periodically what we do is we look at a particular pledge and we sort of calculate the difference that might make in terms of carbon footprint, and we sort of share the positive impact that an individual action has when collectively we look at what that can achieve. We go to the next slide, please. So as well as the pledges, which were kind of the central plank of Dare to Care, we've also had some supplementary campaigns, one just to keep people interested and just to sort of shake up the messaging over, you know, each 12-month period. So the Dare challenges, for example, have proved really, really popular. So whereas with the Dare pledges, an individual might do that, with the Dare challenge, you would get an entire team or a department taking part. So you've got that nice team spirit going on. The 60 Days Green was a campaign similar to the NHS, the National Trust, like 50 things to do before you're 12 3/4. And the idea being that there was a sort of a range of things that were some were fun, some were more practical. And interestingly, we were sort of aiming that at individuals, but it became a really big team-based activity. We had whole teams getting hugely involved and really competitive with each other about how many of the 60 things they could do. That was really, really popular. Breathe Easy September actually launched about 3 years ago, just before the pandemic, and we've changed it since then to Travel Smarter September, in part because with the impact of COVID, talking about breathing easy didn't feel appropriate, so we tweaked that one. But these campaigns have been really helpful in keeping sustainability alive, and that's one of the key aspects of the whole program so far, is not just letting things, not just dropping some information on people and saying that's enough, but keeping the flow, keeping people stimulated, keeping people interested, and repeating the core messaging so that stuff really does land. Go to the next slide, please. as well as using more traditional communications channels. So we've gone out through, through the intranet, through screensavers, we've got posters on sites, we've got a website with the blog posts, we're active on social media, but we've also gone through the mechanisms of the organisation. So we've got a animation that is part of the induction process, which explains about Care Without Carbon. We've got a leaflet that goes out because inductions have become digital. They get sent a little info pack, and we've got this digital leaflet that goes in there. So people who join the organisation know from the outset that this is something that matters to the organisation and that they want their employees to support. And that's been really, really crucial. And we're now taking that a step further in terms of bringing that into the recruitment process and into the appraisals process as well. So it's sort of reaching out how we're communicating beyond just your traditional channels. We go to the next slide, please. We also have Care Without Carbon Envoys. So our envoys are really just, it's another word for champion, really. And we ask people to self-nominate to be an envoy, and they must get their line manager's approval to do it. And what that does is it ensures, because we asked for a time commitment, so we're saying, at least 3 months in the working month, we'd like you to be actively doing stuff to support Care Without Carbon. So getting line managers' approval on that ensures that they get that time within their working month. It's also built into their appraisals process then, and they can reflect on that, and the work that they do is valued and recognised by the organisation through that. For our envoys, we provide a monthly toolkit, and within that, that links in with what we're trying to achieve with Care Without Carbon, so they're directly supporting the aims of Care Without Carbon. And their task is each month to ensure that this is an agenda item within their team meetings. And it's a really great way. Again, it's reaching into the fabric of the organisation, into the sort of the operational functioning of the organisation, and ensuring that talking about sustainability is normalised and becomes just part of the language of the work that people are doing. And next slide, which I think is getting close to the final slide. So, does it work? Have we actually got where we wanted to with Care Without Carbon and sort of trying to talk to people through Dare to Care? I think that we have. We've captured some of our key wins on here. So we've got 30 of our envoys across the organisation. Over the last 10 years, we've saved about 10 million. The sites where we pay the bills, we're now 100% renewable. We've saved 1.5 million business miles, encouraging people to travel differently or to invest in electric vehicles or electric bikes. We've got green spaces on our sites. We've got a whole reuse network now through Warpit and also through eBay. And we've sowed the seeds of a culture that supports sustainable healthcare. So now with Care Without Carbon to take us to 2025, we can build on these really solid foundations to hit that really tricky net zero carbon by 2040 target. And that, I think, is my final slide.
That's fantastic to hear, Hayley. I think there's something there really about the building it into business as usual processes. So you're hitting not only subconscious but conscious levels of people having to think about sustainability and how it, in your role, what can you do? So, and not just it being, because it does traditionally sit in estates, as you say, it's pulling it out of that and making it more, as you say, into the fabric of an organisation. And it shows that it's obviously had an impact. So that's really, really great to hear. And the next speaker is Anne, and Anne will talk about it from a more national perspective, because Anne is Senior Net Zero Engagement Lead at NHS England and Improvements, and you'll touch on the communications and engagement in delivering a net zero NHS, which is the bigger picture piece.
Sorry, Sarah, can you see my screen okay?
Can do, yes.
Excellent. Okay. Sorry.
Just disappeared.
Sorry, let me try one more time.
Right. In the interim, Hayley, are you happy for the slides to be shared? We've had a question through, so your case studies. You're on mute, but I can see you nodding, so we will we'll be able to share this afterwards. Yeah.
Great. All right, I'll kick off. And Sarah, I presume everyone can see and hear now. So I'll get going. I'm conscious of time, and I know that people would like to ask lots of questions, I'm sure, so I'll keep this swift. Yeah, I mean, Hayley presented a fantastic example of what a leading trust, I guess, is doing in this space across the NHS, and to see how it fits into the bigger picture. I work within the national Greener NHS programme, so looking after communications around the Greener NHS at the wider national level, and we work very closely with lots of trusts across England to deliver a greener NHS. I thought I'd go through a bit about me, the story of our net zero ambition, engaging the workforce, and what next. In the interest of time, I might skip over a bit about me, but essentially I wanted to give you a lovely picture of my time in Australia. But basically my background is as a science communicator and working across health and science in the lead up to now, where I've been with the Greener NHS since March 2021, so not too long, but certainly a very busy period in the lead up to COP26. So I thought I'd kick off the story of a Greener NHS with a story, and quite an exciting and lovely one at that. So this year, on 9th of September, a little baby girl, Rosie, was born. Nothing unexpected about her birth. It was safe, but it actually made history. She was the first baby to be born with her mum receiving climate-friendly gas and air to support her during labour. So that machine allowed the harmful nitrous oxide to be removed after she had benefited from the pain relief during labour. And given that's such a powerful greenhouse gas, the opportunity here to reduce emissions through this type of technology is absolutely huge. Just 8 million litres in that birthing centre alone, but if you think about that across the whole of the NHS in England, it's a huge opportunity there. And the beauty of this story is that it's not an isolated incident. There are so many examples of fantastic innovations across healthcare technology and actions that staff are taking. But where did it all begin, Sarah? That climate change was identified as one of the greatest threats to human health, and also on the flip, one of the greatest opportunities to improve health. So it's absolutely core purpose for the NHS to be addressing climate change. It simply cannot work to be improving health without addressing climate change at source. And almost 5% of UK carbon emissions comes from the health sector in the UK, so it's a huge component of how the UK is actually going to deliver on its net zero ambition. Very, very excitingly, in October 2020, the NHS became the world's first health service to commit to reaching net zero. I think, as Hayley's indicated, the NHS itself has a huge and long history of sustainable action, which is really, really fantastic. But of course, it's going to take the support of all its staff, its suppliers, to reach this goal. So today I'm going to sort of mainly focus on the workforce, but of course suppliers, partners, public and patients are going to be absolutely crucial in the delivery of this. I think for me, I've really resonated with Sir David Attenborough's comment very recently in the lead up to COP. Politicians must lead and give people confidence that the changes to reach net zero are desirable and possible for all of us. And I think we've really embedded that within our strategy. We want to lead, the NHS needs to lead this to give people confidence, and it needs to make delivering net zero healthcare desirable and feel possible in order for it to happen. So how are we doing it? Can't really do any communications without understanding who you're talking to. When I joined, we delivered a YouGov poll to understand where people were at, particularly off the back of the pandemic. Were people even interested in this issue? Were they really tired and worn out and not engaged? The surprising, or not really surprising actually, because it's absolutely crucial to improvement of health, there's absolutely huge support across the NHS for the NHS taking action, but actually a lot of limited awareness, we found that not many people were aware the NHS had actually made this commitment. And I think not knowing that was presenting a barrier, and we knew that we needed to address that at a national level. Lead from the front. So I don't think we can call and ask people to take individual action without demonstrating that leadership are really behind this in a meaningful way. An incredibly powerful video from our new NHS chief executive came out and really stated that the climate change
I think we've just lost Anne. Just give her a moment.
Demonstrate their support, giving.
Oh, Anne, I think you're in and out at the moment. I think your signal's dropping.
People really that permission to act at different levels. Can you hear me now, or is it still gone?
I can hear you now, Anne. It's a bit patchy. Okay, what we'll do then is we'll give Anne a moment, and perhaps we'll come to some questions first of all that are in the chat just while Anne is getting back to us. So one for you, Hayley.
Can you hear me now? Okay, sorry.
Oh, you're back. Excellent.
Great stuff. I'll wrap up quickly. Hang on.
Okay. Thank you, Anne.
Can you see okay? Hello? Yeah. Fantastic.
Perfect, thanks,
Okay. Great. So yeah, we launched a national campaign ahead of COP26, which really put the emphasis on the health, making NHS staff feel that this really was part of what they were here to do, which is the improvement of health. And that was really picked up across around 220 trusts across the NHS during and onwards post-COP. And possible, I think Jo made the really important point that we need to really, as communicators, share progress through stories, and that's exactly what we've done. One here from Polly, who cycles to deliver care in the community. It's actually an example from Hayley's trust, and also we presented the world's first net zero hydrogen electric ambulance at COP26, and a lovely picture of Sajid Javid next to it there. And I think people haven't mentioned COPs so much, but for us it really was an opportunity to accelerate action. Of course, so much is happening across the NHS already, but COP presented that moment to really try to harness that momentum, and we did that mainly across the supply chain, but of course across the work that we're doing with people within the NHS. What next? Can't go alone, need to work in partnership, absolutely. With trust, but also with other partners. An example here with NICE, and of course prioritise where we can make the biggest impact. So yeah, that was a whistle stop tour, but I'm going to stop sharing now and hand it back to you.
Lovely, thank you, Anne. I'm glad that you managed to rejoin us. So I just before we kick off into main questions, that we've had a couple through just specific about your campaign, Hayley. So I just want to check on over what timescale did you develop that campaign, and how many staff were involved in its implementation?
So Care, we worked with an agency to develop DARE over a period of kind of 4 to 6 months, including development of a website. And on the Care Without Carbon team, at the time there were 3 people on the team. And then so Care Without Carbon sits within the sustainability section of the trust, and then my role as comms manager within Care Without Carbon, I fed into the trust's wider comms team, who then supported through the trust channels.
Thank you. Lovely. And there is another question, but we'll come back to that in the natural flow of questions. So first of all, coming to you, Hayley, how does the healthcare sector contribute to climate change? We heard from Anne about that the NHS contributes 5% almost in terms of carbon footprint. So what does that look like?
So, I mean, sort of thinking about health and care on a sort of a more global perspective, it contributes around 4% to global carbon emissions. So outside of the NHS more widely, there's still a really significant footprint there. I mean, it really splits down into various things. There's the pie chart that Anne showed you. You've got buildings, you've got travel, you've got the actual delivery of care, you've got your medicines, you've got equipment. If you think about something like, for example, kidney dialysis, 1 year of kidney dialysis, the carbon footprint of that equates to 7 flights London to New York. So it's just a really sort of, it's a neat way to sort of summarize it in a way that sort of is easy to understand. I think that, of course, we have to give people kidney dialysis, but thinking about how we can do that differently. That's the example that Anne gave in terms of, you know, changing the way that gas is used in birth and having something to extract that gas out of the process. So it's about being innovative about how we deliver care. Overall, if you think there's so many ways that we can tackle it, and I think tackling all of them at the same time will be really interesting to see the case studies that come out that, you know, they're already sharing through Greener NHS. Air pollution is a really big example. You know, 1 in 20 vehicles on the road traveling on NHS business. And if we think about air pollution contributes to around 20,000 deaths in the UK each year. So, you know, clearly in delivering healthcare, we are actually contributing to the problem of climate change. But as Anne said, that also gives us the opportunity to contribute to solving the problem of climate change.
Yeah, it sure does. And coming to Anne, what does net zero NHS look like and how can we achieve it? And it builds on this question. What's the vision?
Yeah, absolutely. So I think that, you know, first and foremost, I think a net zero NHS looks like the delivery of high quality clinical care to patients. That really is what it's going to be, with the added benefit of improved healthcare outcomes, because we will have reduced carbon emissions. And therefore, you know, as Hayley was talking about air pollution alone being, causing sort of 1 in 20 deaths in the UK, you know, we can look forward to better health outcomes, but also great clinical care. And I think one example of that would be that in Oxford, they are kind of pioneering the delivery of chemotherapy drugs through e-bikes. And as a result, they're halving the time of delivery of those drugs to pharmacists and to patients. And so actually we're reducing air pollution locally, but we're also improving the delivery of care. So I think what people need to realise is that sustainable healthcare is just simply great clinical care. And I think ultimately, you know, how can we achieve it is, as Hayley was saying again, you know, it's got to be a thread through every single element of the NHS. It's got to be a way of thinking, really. In future, we just need to think about it first and realise the opportunity that we have.
Thanks, Sam. And Jo, coming to you about stakeholders. So how can we communicate the value and benefits of sustainability to staff and external stakeholders?
I was on mute. The dog decided to bark. Just it's always the way. Yeah, it's a really interesting question, actually, Sarah, because and this is something that we ran a series of roundtables with industry on as the HCA, discussing this very subject. And last June, we published a presentation for communicators as like a template to use within their organisations. And it's called Beyond Reputation, Helping Pharma Deliver Value from Reputation. I'd be happy to share the link to it. And it was designed as a sort of help guide to help the development of a sustainability strategy with practical steps for making the case to investors. But the fundamental message, which I'm not sure gets through that often, is that successful sustainability strategies are good for business. Investors don't want to invest in an unsustainable business because then they get an unsustainable return. Employees don't want to work for a company that's not helping the climate crisis. So I think for me, it's about reminding people the great benefits of being a sustainable business. So you can do good and you can still make a profit. You know, and it sort of goes back to the textbook definition of sustainability. And it's about, you know, meeting the needs of the present, but not compromising future generations' needs or their ability to meet their own needs. And so I do think it's like reminding people all the time that this is not something that business, you know, is going to suffer from. Quite the opposite. This is something that it actually makes for good business, and I think that's important.
And a question that we've had through relates to panelists here. So how have panelists gained / maintained staff willingness to use public transport during COVID? So this is, you know, it's a very difficult message, isn't it, about using sustainable ways of travel versus keeping safe, in particular from a healthcare perspective. So so they're saying that they're doing a big push on green travel and public transport pre-pandemic, but have found a lot of people still reluctant to switch from their cars due to COVID fears. Thoughts on that?
I think it has had an impact on people's willingness to use public transport. Maybe less so now. We're seeing more people willing to use it. Where our emphasis has been on people choosing active travel. So we're looking at ways to support people in walking to work, in cycling to work, enabling people to purchase e-bikes, for example, and having the infrastructure within the workplace to support people to make those decisions. So, for example, somebody may well be perfectly happy to walk to work, but actually once they're there, they need to zip about to different meetings at different sites, and so they're choosing to drive for the convenience of being able to do that. So we've established a pool of electric cars that staff can just borrow to travel to meetings, which then enables them to make choices about how they're commuting to work and make more sustainable choices.
Excellent. Any other thoughts?
Yeah, I just want to make a point about transport generally, and just a sort of personal experience recently. I took my children for a long weekend to Paris for half term, and I was looking at the costs of travel, and the cheapest way of getting there was to fly, which seems totally wrong, because obviously that's got the biggest kind of environmental impact. And so a bit like what I was saying about the AstraZeneca share price when they said they would look at making the vaccine available not for profit. This is where I think governments do need to intervene, and we do need to have policies to support the more environmental choice. So I just thought, I mean, I know it's not entirely related, but I just thought that was an important observation, is that actually I think it's sort of stacked the wrong way.
Excellent. And then coming to you, Anne, so with COP26 over, how can we continue to inspire action, and what were some of the outcomes?
Yeah, absolutely. So I mean, I think probably start with some of the outcomes from COP26 and the work that we did in the lead up to that, and there I think there are probably two main things that we I guess got from COP26 and hope to use as a bit of a springboard afterwards. But I think essentially COP26 presented the external environment that gave us permission to really go out and talk about this really strongly across the NHS. As you can probably imagine, over the last 18 months or so, the NHS has had many significant priorities to be dealing with. But COP26 allowed us to really come out quite strongly at a national level. So that enabled us to really grow the number of people across the NHS who were engaging with us, who were searching Greener NHS, who wanted to find out more. And I think that really, that sort of raising awareness is the start. So we saw really significant growth across all of our digital channels, but also across our trusts. And I think another key outcome was really to use COP as a way to raise ambition across our supply chain. More than 60% of the NHS carbon footprint sits within its supply chain, and the NHS procures from more than 80,000 suppliers. It has a huge opportunity there, not only to reach net zero as an NHS, but also to inspire organisations around the world, not just in the UK. The NHS is an international procurer, to really reduce its emissions for a supply chain. And so we use COP as a moment to gain the support of about 12 of our major suppliers, each together account for the emissions of the 10 largest cities in the UK twice over, to make bold pledges, 5 of whom had not made any net zero pledges before they engaged with the NHS. So health was a really powerful motivator. So I think COP gave us a really strong opportunity on those fronts. And what next? I can't do this alone. I don't think Hayley can do it alone. We can't work alone. And to reach net zero, we absolutely need to work together. And I think we need to build on this momentum, but think really carefully about partnerships across the NHS, but also with suppliers, with external partners, to really engage every corner. I think that's really where our efforts are going to be moving forward.
Sure. And coming to you, Hayley, and it's building on that. So how can we balance sustainability while providing high quality healthcare? And it really is a balance, isn't it?
It is a balance. And I think, one of the things to remember about healthcare is it's not just about fixing people when they're unwell, it's about preventing people becoming unwell in the first place. And given the impact that climate change has on health, ensuring that we reduce the impact of climate change is delivering excellent healthcare, because we're helping people stay well, and reducing the negative impacts that climate change can have. But I think overall, sustainable behaviours are healthy behaviours, and as Jo said, quite often sustainable choices are actually financially more rewarding as well, certainly in the longer term. So within healthcare, doing things differently that makes it more sustainable will enhance care. There's not a clinician on the planet who would make a choice simply to be sustainable that would then result in negative care. So it's always going to move us forwards, which is great. It's a really important message that what we do to be sustainable benefits everyone. It benefits patients, benefits the books, and most importantly, it benefits the planet.
Indeed. And coming to you, Jo, I'm going to conflate two questions that we did have prepared into one, because I think they probably cover similar areas. So given we know what the trust, the Edelman Trust Barometer says about business is where trust lies, more so than any other agency such as government, etc. So what can business do to help the climate crisis given that context?
Very interesting, actually, because I did look at the Trust Barometer and actually spoke on a panel about it for Edelman. It's a nice position for the pharma industry to be in for a change, because business is often viewed with some skepticism or cynicism. I think it's largely down to the COVID vaccines, that people saw what the industry can do and can do very well. And it's great to have that trust. I think, as we all know as communicators, the message is only part of it, but a huge influence is the messenger. So I'd like to think that with our sort of, new halo reputation, that we can do some really good things. I do think that for businesses, we need to go beyond just the PR exercise. We talked about greenwashing, but it really is about walking the talk and taking decisive action. In the presentation that I talked about that the HTA put together, it talks about implementing an organisational wide strategy and having milestones that you can measure progress against. And I think business and industry are very good at doing that. They're very good at measuring things. It's really important that we continue to do that. And I should have mentioned and didn't, but the ABPI, our trade association in the pharma industry, I know is working with Greener NHS, and they have a big sustainability program as well. So exactly as Hayley and Anne talk about, that collaboration is really important. Business can't do it on its own either. So let's use this kind of new reputation that we have, or the better reputation that we have, and rightly so, should I add, to actually do some good and work collaboratively with our partners to make a difference.
Thanks, Jo. I'm going to come to some of the questions in the Q&A now. As I'm conscious of time, we have less than 10 minutes. So let's come to the first one here. So how do NHS medicines and device suppliers effectively communicate sustainability actions and goals in order that it aligns with the NHS net zero ambitions, particularly when they might not have experience on that? Does anybody have any thoughts about how that could be answered?
You can certainly build it into the procurement process. It's something we've started to do with our trust, and we set out really clear criteria about what we mean when we say we'd like our suppliers to be sustainable. In some instances, we might set out a sort of minimum standard for example, a percentage of a recycled product in something. So I think sort of creating the policies and the processes that inform and set out really clear boundaries for where we'll go on sustainability with our suppliers is a really helpful starting point.
And there's an interesting question here about underserved and or underrepresented communities as part of the wider sustainability conversation. So how do members of the panel help navigate this discussion internally and with patients and other stakeholders? And I wonder if we can come to you. Is there something around reaching underrepresented and underserved communities that you're doing nationally? Although you might be having a few issues with your internet. I think you're having issues with your internet. Would anybody else like to comment on that question?
I fear it has failed me.
Oh no, we can hear you just about.
Can you hear me? I'm so sorry, I'm not sure what's going on here. I'm so sorry, I only heard how can we navigate the challenges. I'm afraid I didn't hear the first part, so maybe someone else might want to.
Sure, we were talking about underserved and underrepresented communities and how do we reach them in a way that helps the conversation further around sustainability.
Well, I mean, I think I can probably make 2 points on that. I mean, before those 2 points, the first is obviously it's a challenge that I think everyone grapples with, but absolutely critical. I think first and foremost, the impacts of climate change are affecting some of the most sort of underrepresented and vulnerable communities in our society. So it's absolutely critical that they are part of the conversation and are part of our ability to sort of overcome and address climate change. It's absolutely essential to what we do. So we do need to be able to reach and engage with them. I think what I said before in terms of the second part of that, what we want to do next, and I'm sure Hayley probably has examples, given she's worked in this space for a lot longer than I have, but is that we really want to work in partnership, and we want to work where we're going to make the biggest impact on the delivery of our policy priorities and work with those communities where the impacts of addressing climate change within the health system is going to have the biggest impact. So absolutely, partnerships for me is, I think, critical in how we do that.
Excellent. And so is there any learning from the NHS experience that we've had a question, how can a physician in the US learn from NHS experience? Perhaps the Greener NHS website or any other resources that the panel would think would be good learning opportunities?
There's so much on the internet now. So you've got the Centre for Sustainable Healthcare, you've got Healthcare Without Harm, who are global. There's a range of resources, as well as those provided by Greener NHS, that are really bringing together healthcare communities and trying to amplify the message, trying to amplify action. And if as a minimum, simply Google sustainable healthcare and you'll get a page of at least 10 links that will take you to something that will be informative.
And just one final question to close on, as I'm very conscious of time. So if you could summarise in 1 point, what would be the one thing that communication professionals play within this agenda in each of your sectors? So Hayley, for you within the trust perspective, Joe from business, and Anne from the wider national. Coming to you first, Hayley.
So from within a trust perspective, I think it's about normalising sustainability within healthcare and helping people see whether they're a cleaner or an admin function, or whether they're a surgeon, that being sustainable is part of their role. It's not an add-on, it's not an extra nice to do, it's a function of how we need to deliver healthcare going forwards.
Lovely. And Anne, coming to you.
I think first and foremost that all of our efforts towards delivering a net zero health service are for the benefit of improved health now and for future generations. This is why we're here. This is what we're doing. It's absolutely core purpose, and therefore, as Hayley said, it should be embedded across everything that we do.
And finally, Joe.
I think it's that point that I made, that sustainability is good for business. That if we want to have a business in 20, even 50 years' time, then we have to address the climate crisis, and we have to do it now.
Excellent. And that's a really lovely note to end on. We have to act now for future generations. So thank you so much for joining us. And as I mentioned at the beginning, this is the first of the CIPR's climate communications series. So there's another 9. So do check those out on the CIPR Twitter feed, where you can find out more information about the further events which are coming up before Christmas. A reminder that this event is worth 5 CPD points. So make sure you log that. It's important to get your points up for the year, and we've heard a lot from our speakers today, so do check out things like the Greener NHS, the HCA website. The Good Cop Bad Cop webinar sounds really interesting as well, and that's due to be published later this week, isn't it, Jo? And finally, I'd like to end on that the CIPR Health Committee is looking for volunteers. We're in the process of working up what our work plan is for the year, so if you want to help support professional communicators working in the healthcare sector, that's both public and private sector, and helping us put on events like today, we'd love to hear from you. So again, check out our Twitter channel, which has got more information. So thank you very much again for coming in to speak with us today, Hayley, Jo and Anne, and I will leave everybody to say goodbye.
Thanks, Sarah.
Thank you. Bye.